Okay, all set?
She hasn't come. Yes, we're live now. Thank you. Thanks, Millie.
Thanks, June. All right, good afternoon, everyone, and welcome to this decision day. If we just crack on, I think, Jonathan, you're first up with the financial position.
Yes, thank you, Councillor Fairhurst. So this is the budget setting report for adults health and care, which is brought to exec member each year as part of the council's overall budget setting process. The report recommends approval of the 2026 to 27 revenue and capital budgets and the 3-year capital programme for submission to the leader and cabinet in February. The report also recommends approval of the officer proposed SP26 savings, which total 4.2 million set out in Appendix 3 of the report, and the proposed fees and charges for 26 to 27 set out in Appendix 4 of the report. The report provides an update on the council's overall financial position following the provisional local government finance settlement in December. The budget gap is reduced from 143 to 136 million due to a slightly more favourable settlement than expected. However, the funding outlook does remain very challenging, with the council expecting to lose about 9 million of grant funding next year. Section F of the report details the key directorate challenges and priorities for the coming year. So we continue a significant programme of work to address the key issues of rising demand and cost, which focuses on maximising independent living at home and delivering more efficient ways of working through innovation and use of digital tools. Section G of the report provides an update on the in-year monitoring position, with an adverse variance of £14.6 million forecast for the year, and the key pressures arising within older and younger adults purchased care. The report then presents the impact of these in-year pressures on the proposed budget for next year. When taken together with allowances for additional growth in activity and prices, which are expected to occur next year, this has required total additional funding of £50.2 million within next year's budget. Section I then provides an update on the progress towards delivering the existing SP25 Phase 1 and 2 savings, and it proposes additional SP26 savings of 4.2 million, of which 4.1 million are deliverable next year, and further details are set out in Appendix 3 to the report. The report then summarises the combined impact of all these changes in funding and savings on the proposed budget for 26 to 27 in Section J. Section K sets out the rationale for the proposed increase in fees and charges for next year, which are detailed in Appendix 4 of the report. An increase in charges for self-funders within HCC Care is proposed, capped at a maximum of 10%, and a change in charging approach, which would see further increases the following year for some service users, which would be subject to consultation with those affected. This would bring our charging approach into line with how care is commissioned in the independent sector, and would create a clearer link between the cost of the service which an individual receives and the charge for the service. And then finally, Section J of the report outlines the Directorate's 3-year capital programme for 26, 27 to 28, 29. There are 3 key strands of younger adults supported accommodation, older adults extra care and maintenance of operational buildings. The younger adults supported accommodation programme includes 2 million of new funding for grants to housing providers to undertake modifications to existing stock to provide extra units of supported accommodation to support the delivery of our SP25 savings. And that's all I was planning to say by way of introduction. Thank you.
Thank you, Jonathan. Simon.
Can I just, Jonathan, you quite said, this also includes the ring fence grant allocation we have for 26, 27 in that budget, which is ring fence from the DHSC.
Thank you. Just one thing, and it's a very minor thing. When I was looking through it, Jess, you can probably answer me this. Why do we charge more for Orchard Close for respite than we do for Jacob's Lodge, Heinsohn House and Newcroft?
I suspect that that's down to, so we have a full cost recovery model. So we look at the cost of a particular service
Mhm.
and then divide it by the number by the level of use it has, and that's how we attribute the cost to it. So I would imagine that it's related to that, Councillor Fairhurst.
Yes,
Um,
I just wondered because, you know, knowing all 4 sites, I could put them in a pecking order of where I think would be the nicest place to go, and I couldn't understand why there was a discrepancy. But okay, that makes sense. Thank you. Now, we looked at this quite carefully at HASC. So I'm going to ask Councillor Withers what HASC made of it all.
HASC noted the report and we're very happy with it. There was some serious scrutiny by some of the councillors, to which Jess and her team answered, Jonathan answered in an excellent manner. And at the end of the day, we accepted the report to go forward with the recommendation.
Thank you. And you have no further questions?
No further question.
No. Stephen?
No, I've got no questions either. Liz, I think it was given a good going over at HASC.
Yes. Okay, so in that case, I'm very happy to approve all the recommendations and just say thank you very much to you, Jonathan, for all your work
Thank
and
you.
for making it quite simple for the rest of us to understand. So thank you. Okay, and I think now I'm going to hand over to Stephen because I think the next 2 items are both his.
Yes, thank you, Liz. The first report that I need to make a decision on is from Simon, and it's on the approval to spend for the public health nursing service. I'm being invited to make the most expensive decision I'll ever consider. Simon.
Many thanks, Councillor Reid. So just to set out in high level, this report is part of our statutory duties spent from the Public Health Ring Fence grant to spend on the 0 to 19, so that's health visiting and school nursing service for a maximum contract year of 7 years. Joe Lockhart will take us through any particular details that are relevant.
Thank you, Simon, and thank you, councillors. So yes, so this is paper is seeking approval to spend for a 5 + 2 possible extension year contract, so 7 years in total, as Simon said, from the Public Health Grant. The Public Health Nursing Service consists of health visiting, which is mostly focused around supporting families with babies aged 0 to 5 from pregnancy onwards. It includes the Family Nurse Partnership, which is a particular intensive offer for young parents, so teenage parents, ordinarily under the age of 16. And the school nursing element, or otherwise known as public health for 5 to 19, public health nursing for 5 to 19. This offer is universal across the county, so it's county-wide for all families. It was primarily based either as a home visiting service or a community-based service in areas that people, we take the service to them wherever possible in their local communities, or as a school-based service where they will go into schools to meet with young people. There is also a digital offer that supports this. The primary function of it is to lead the delivery of the Healthy Child Programme, which is a programme that is, we have commissioning guidance that is followed. It provides 4 levels of offer. The community level is where families can find their own information and advice and access courses to help them through whatever challenges they have. So that might be about a transition to parenthood information course, as an example. The universal offer consists of the 5 mandated contacts, where the first one happens antenatally at 28 weeks pregnancy. Then there's a new birth visit, 1 at 6 to 8 weeks, and then there's health for development reviews at 9 to 12 months, and then 2 to 2.5 years. These are really critical components that will then lead into the other 2 levels of service. So one of the skill sets is their ability to identify need. The targeted level of service offer will be a short time limited offer on a particular need. So that might be some advice around breastfeeding, for example, or around healthy weight or emotional well-being. And ordinarily those families will either then drop down into the universal offer again or be signposted for further support. The specialist level is where things are more complex and chronic potentially. It might be more multi-agency support that's required at that stage, linking with other services in the system, such as the early help teams. The main aim is to focus on reducing health inequalities, so they will absolutely be prioritising families and assessing those needs so that the most vulnerable families are the ones that are really targeted to get that support. An example of that might be in Rushmore and supporting the families of asylum seekers coming through that system as well. They are really well versed at identifying that need and referring on to specialist services as required. The service is monitored through robust contract quality monitoring. We have a submission that comes in on a quarterly basis that's full of reporting against their key performance indicators, some information requests, and a wider annual audit schedule. In addition to that, we have quality assurance visits where we go out 3 times a year looking at a particular theme and identify learning. So they do have this continual learning ethos, and we have found this approach has been incredibly effective through the life of this contract. So we will continue to do so. The work that we have done to forecast for the life of this contract, we've taken advice from our finance colleagues, our legal colleagues, and our procurement colleagues, and we have forecast that the funding required to cover the potential 7 years of this contract will be up to 200 million. The key aim is, or one of the things that's really important to notice is, whilst that sounds, as you say, like a lot of money, it provides a really good value for money service. The aim is to prevent, eventually, to identify those needs at the earliest opportunity and prevent those needs from escalating further, where the costs will then be greater. Have I covered everything? Would anyone have any questions?
That's good.
Yeah.
It's good.
Thank you.
So, Liz or Bill, any questions?
Not from me, Stephen.
Bill?
Well, I fully support everything that's being recommended there. One of the things I note as a man and a granddad is that with a young child, 16 months old, when I ask about what inspections, what tests the team have done, some of the words that come out I find very difficult to understand because they're very technical. And I just wonder, in dealing with young ladies in deprived areas, do they actually understand some of the medical terms that come out? You know, we talk about easy read and everything else, but some of them are very, very difficult to grasp the meaning of straight away. It's nothing to do with what's being spent, but it's just how people in deprived areas actually interpret what's being said to them by the nurses.
Councillor Withers, there's a number of things to think about there. And you're right, we need to make sure that the interventions that the staff undertake are understood, and health literacy is a key part of the service to really upskill the parents, whether that's the mum or the dad or even the grandparents, so that they can understand and enable our families to thrive. But you're right, and we can pick that up and just do some work with the service just to double check that.
Thanks.
If it is at all reassuring, that is part of our continual quality improvement lens. So we do continually work with the service to identify those needs, and they are one of their key performance indicators is collecting service user feedback so that we can look at areas that we need to pick up and improve with them. So we do try and use that voice of the family wherever they are in the county, and whether they're mums, dads, partners, etc., to keep working on that.
Thank you.
Thank you. I was really grateful, Joanna, that you put in your introduction a couple of references to how we monitor the delivery on this. Voting the money is the easy bit. Delivering the service successfully is, I think, the more difficult bit. And Bill's question was just about what chance is there that the difficult how to phrase this. Some people have managed to address these services more easily than others, and the ones in greatest need are the ones most likely to fall through the cracks. I think that summarises the Bill's question. Do you want to add anything on that?
I can come in if that's helpful. So one of the benefits of health visiting is that when you work through that pregnancy journey into health visiting, everything is universal. So it is one of the skill sets of the public health community nurses that we have, the health visitors in that case, who can, in a really approachable way, speak to families and really unpick what those needs are. So their aim is to absolutely, and we've tested it over the life of this contract, prioritise the most vulnerable, identify what those needs are, and ensure that they are connected with the right services wherever possible. There is always learning. We're a very large population. There is always learning that can be done, but they're highly skilled and they work under that supervision model to ensure that actually they're not that practitioners aren't working in isolation. They're working with others where they can sound check and make sure that they are picking up those needs and therefore helping them all as much as possible. Does that answer your question?
I think it does. It's the focus has got to be on the delivering, and you obviously have ready answers and experience on how to do this successfully. And anything that anyone else would like to add? Okay, well then the recommendations I'm being asked to consider is that I give permission to spend up to £200 million from ring-fenced public health grant funds on the public health nursing service, April 27 to March 34, and that we delegate authority to the Director of Public Health to enter into the contract arrangements in accordance with the procurement regulations for that sum of money. I'm very happy to approve those recommendations, and I'll watch with interest on the success of the work that continues to be done.
Thank you very much, Councillor Reid.
Thank you. And then
Thank you.
The next one is increased smoking cessation in community optometry services, which I found very interesting when I read this. Simon, do you want to speak to this?
Very quickly, Open and Sarah will follow. So we have a specific grant for tobacco control, and we know that smoking cessation is the best thing someone can do for their health. So this is another opportunity to work with a new community of professionals to help them refer and increase smoking referrals. Sarah, I'll hand over to you.
Thank you and good afternoon. Yes, the aim of this paper is asking for approval to spend for a grant of up to £250,000 to Hampshire and the Isle of Wight ICB for the purpose of a local incentive scheme for embedding smoking cessation conversations within optometrists in Hampshire. As a background, we know that smoking is absolutely linked to eye disease, and that includes cataracts, glaucoma and macular degeneration. But we often don't locally see direct referrals from optometry into our stop smoking services. A national survey a few years ago did identify that optometrists do see having conversations about smoking as part of their role, but things like lack of training and time are barriers to this. Furthermore, health professionals are generally the most trusted people to receive health promotion advice from. The Integrated Care Board are the commissioners of optometry in Hampshire, hence why they would be the recipient of this grant. As Simon mentioned, the funding is from the ring-fenced National Local Stop Smoking Services and Support Grant, which aims to increase the number of people quitting smoking. So the aim of the local incentive scheme will therefore to sustainably support optometrists in Hampshire to have conversations and then go on and make those referrals to our Hampshire Stop Smoking services. This will be through activities such as training the staff, undertaking marketing, appointments of smoke-free leads, recording smoking status for people who they see through their organisations, and then actually going on and making those referrals. So working with the Integrated Care Board, we will make sure we monitor the impact of the scheme thoroughly through reporting on metrics such as proportion of staff trained, proportion of people with smoking status recorded, and then the numbers of referrals that are made. So we're in the process of engagement with the local optical committee, who are engaging with kind of optometrists who work with them on the committee, and the feedback thus far has been really positive. So the next steps, should you approve the grant, is to agree appropriate remuneration with the local optical committee and then gauge interest from optometrists in Hampshire. Thank you very much.
Thank you. Councillors, Liz, Bill, Leslie?
Nothing from me. I just hope it works.
And
yeah, the only thing I would add is that now we're the ICB for Hampshire and the Isle of Wight is inheriting the northeast area. I assume if there was any funding from the Frimley ICB, it's coming across for that policy.
So, Councillor Withers, the funding for optometry for North East Hampshire will come when from to Hampshire and Isle of Wight. This funding is the county council's funding, so it will fund optometrists across the whole of Hampshire.
Thank you.
One of the things Leslie?
I was just going to say, I think that making every contact count with people who come in contact with people is a really clever and insightful way of helping people change their habits, nudging them positively. Thank you.
And Simon's nodding enthusiastically at that one. The question I have, I've been to a number of opticians, and on some of them, especially the larger ones, I felt like I was on a conveyor belt, and I was being processed through their system. So the question then would be, who would actually own, within that sort of setup, the responsibility for identifying a smoker who could benefit from this referral?
Sarah, do you want to take that one?
Yes, absolutely. So obviously we know that optometrists in Hampshire are going to be very different depending on whether they're a chain or whether they're an independent. And to a certain extent, we want to leave it up to the optometrists to work out what works well for them. But we would certainly anticipate that the kind of frontline professionals actually examining people's eyes or talking to them about glasses would certainly be having that conversation because they then have that rapport with that person. Whether or not then, you know, it might be handed on to do some of the actual kind of referral or fill in the forms to the admin team or something would be something that we would hope would be worked out within a local optometrist as to what works best for them.
Okay, well, I think some attention will need to be given to that. And how will we then monitor the diligence of the optometrists in doing this job on our behalf?
Yeah, thank you. So as part of the working with them, we would expect to receive monitoring forms back. So we'd be asking them things like, you know, what activity have you done to raise awareness among your customers? We would ask, as I said, we would ask for somebody who's the kind of smoke-free champion who would be our link into that service. And then we would also be asking them for feedback as to how many staff are trained, looking at the proportion of people who'd had their smoking status recorded, because of course asking and recording is the first step before then you can go on and having those conversations. And then finally we'd certainly be asking them and looking at the data that we receive from our Smoke-Free Hampshire service in terms of the number of referrals and the impact of those referrals in terms of the number of people giving up.
Thank you. I'm sure the councillors would be very interested in those numbers once the scheme's been running for a while.
Absolutely, I'm very happy to share that. Thank you.
Any other questions, anyone?
No.
Okay.
Sorry, I was just going to say to Leslie, sorry, Councillor Minahan, I know you were late. Did you have any questions on the budget, which we'd sort of...
No, sorry. And for some reason I had it in my diary for 2:15. I do have one further question in relation to the optometrist. Can never announcing it that name. Have other areas successfully implemented this? Have we sort of, is it really an original thought for Hampshire?
We know that this sort of scheme has been done for other professions. I'm not aware of something explicitly for optometrists, and certainly the local optometry committee kind of asked their members if they were aware of it, and other people weren't. So it's not something we're aware of has been done specifically for optometrists, but it has been done. I think yes, there's other professions where this has been tried.
This could be a trailblazer. Thank you.
Simon, did you have anything to add there?
I was going to add to Councillor Minahan's questions. You know, we've seen it in dentistry and pharmacy for different reasons. So, you know, this is a brilliant next step, and sounds like the local optometry committee who represent those community optometrists are really supportive, which is really positive for us.
Yes, thank you. It's an interesting observation that with health issues now, we're now starting to use pharmacists as an entrance, a gateway into the NHS, and we're now talking about using optometrists as a gateway into this particular service. So the way in which the public can access important services is changing at the moment, and I'm glad that we're trailblazing on this one. Okay, the recommendations are that I approve a grant of up to £250,000 for the purpose of increasing smoking cessation activity, and that I delegate authority to the Director of Public Health in consultation with me to approve the grant amount and terms within the total expenditure approved. So that's £250,000, and we'll try and get best possible value out of this. And if it's successful, it'll be an example to other areas. So I'm pleased to approve those recommendations. So are there any other points that anybody would like to make?
No.
Okay, then Liz, I'll hand back to you. I think I'm done with my bit.
Okay, thank you, Councillor Reid, and thank you all for coming today in various forms. Thank you all very much. And I think that's it for today. Thank you.
Thank you,
Thank you.
Councillor Fairhurst, Councillor Reid.
Thank you. Julie, do you want to stop the broadcast?
Webcast, please.